Yeah.
And is it quite common for people to book a nurse consult over a doctor's consult, or would you look at the person coming in and say, well, actually, she would be better off to see the nurse. The GP is here to see other people.
Absolutely, and sometimes it works in tandem. Someone might come in and see a nurse first for something, and then go and see the GP, vice versa. Say for example, on our website we'll have a list of services that the nurses do, and then there's what the GPs do as well. So, and again, that will change and be around all general practices as well.
And do you have a receptionist that is a nurse, or just does the nurse do the reception? Because when people call up and ask to see the doctor, are you saying what are you coming in for, or is it are you talking to a receptionist that has doesn't ask what you're coming in for? What's
yes, it's interesting because the triage really starts at reception. The receptions are administrative, and they've had some triage training along with the whole team in our practice, and so they have the ability to ask those questions. You know, what are you coming in for, so you can see the right person at the right time. So yes, they start the triage process there, so they can direct either to the nurses or to the doctors.
Okay.
Yeah.
And what about how does the triage work? Like if I was very unwell that day, need to see a doctor that day, but all the bookings are taken, is there any availability to see anybody on that day?
Absolutely. We have a model of care which is a healthcare home, and it's around making sure that people can be seen when they're unwell. And so we have what we call acute slots for each clinician in our practice, say nurses and doctors. So in our appointments we might have a couple in the morning and in the afternoon. So those who ring in and need to be seen on the day are usually triaged by the nurses, and we'll put them into those slots. And also we'll align them, because maybe if someone's got chest pain, they'll come in and see the nurse for ECG and bloods, and then see the doc from there.
Sure.
So working as a team and meeting the needs and seeing people at the right time.
Yeah. And you're talking about nurses going into areas that they're really passionate about. Doctors obviously would have areas like that too.
Absolutely.
When you're taking on a new patient, or even patients that have been coming for a while, are you likely to put them with a doctor relating to their condition, or is it something that you get whoever it is on the day?
Good question. Probably a mix of a little bit of, it depends on, sometimes the GPs and the nurse practitioners are full in their books and so not taking on at that time, but when they're open then we try to make that fit. And I think also along the way, if you think, oh, not quite fitting with that GP or nurse practitioner or that nurse, as I mentioned before, then you can move around in the practice. Again, different in different practices. Some don't work as teams and work as separate teams, but in our practice, then absolutely. It's important that you find people that you're comfortable with to see and feel confident in their care.